faith, community-driven streaming media. This is the Voice 104.com from the Allison Hill District of Pennsylvania. Studio A, television from Studio B on the Voice 17104.com.
Welcome, my brothers and sisters, to the Richard James Show on 17104, The Voice. Greetings and salutations. Again, welcome, my brothers and sisters, friends, community, to the Richard James Show. And you know what we try to do on the Richard James Show is to deal with issues that are pertinent, particularly to the African-American community and to the community at whole. We have been faced with some real challenges this year. I mean, this year has been a historical year. And today we're going to talk about healthcare delivery systems within the African-American community. And we have, first of all, I want to introduce to you my co-host, Mary James, who is the president of the Harrisburg Chapter of Lynx Incorporated, and she's also my wife. Mary, glad to have you on the show.
Thank you, glad to be here.
And our guest for our first half on our show, and dealing with healthcare delivery systems, particularly to the elderly and people who are in need, is Annette Branch. Welcome, Annette.
Glad to be here. It's an honor.
Fantastic. We're glad to have you. And there are some major problems. The first half of our show, we're going to deal basically with some of the healthcare that's supposed to be provided and has been cut back on by our government. And we're going to talk about those issues. And Annette's going to explain to us what is going on. And then we're going to talk about, how can we deal with some of these, with this issue. But this is very important. Now, this is going to be the first half of our show. The second half, we're going to deal with the COVID virus and the administration of vaccine that is sponsored by Lynx Incorporated. And that will be introduced by Mary James. And we also have two representatives of the Lynx organization that will be coming on, and she will be introducing those people. But first of all, and we'll get started. Can you just sort of, in a succinct kind of way, present what is the general problem in terms of healthcare delivery systems to the elderly? What is going on with government? What are they doing to us or not doing for us?
Right now, we have a situation where you have a judge and a jury type organization, UPMC, the University of Pittsburgh Medical Center, who has the ability to be responsible for the caregiving agency, the nursing homes, and so forth. But in the most recent month, actually in my case, I have had my hours from 168 hours reduced to a mere 77 hours. And even though my doctor made it very clear that I'm required to have around-the-clock service, I could die at any moment. I have been resuscitated from my home, taken to the hospital. I've had severe nosebleeds from my hypertension, taken back to the hospital again. But meanwhile, you have people who say, well, I was asked this question, do you still drive? Yes, I do drive, but I don't drive when I have a caregiver that's taking me to and from the doctor. I've never had an accident in 60 years. I don't have a parking ticket. I'll take that back, yes, for not moving my car when they were cleaning the streets. I forgot that one. But nevertheless, the point I'm making is you have people who are relying upon, as we speak right now in this city, who are lying in feces and urine because there's no one to change their linen or to care for them to give them a meal, because the hours in some cases have been shortened to 3 hours or less. And you have people who, unlike me, who can speak, can say, this is what's going on. This is what's happening today. They can't. They've had strokes. They had, their health does not allow it, nor does their blood pressure allow the stress that I'm doing with a heart condition. And I just want some people to look at this as an advocacy type thing that we have none here in Harrisburg. We don't have a strong advocacy group that's saying we don't have the money or the manpower to actually get the federal funds to allow us to fight back, to fight an organization. In fact, if you go to the computer right now, you can find this despite pandemic. UPMC rakes in a record high $23.1 billion in 2020 revenue. And the TRIB newspaper published that on Tuesday, May the 11th. So I'm not making this up. This is happening. It's happening right now. And so many times until we're at death's door, many of us have to wait until we're in our 60s or late 70s and 80s to realize it's your money. You've worked hard. You know, now you're unable to work, since I understand America is a youth-oriented type country. If you're able to look beautiful and young and able to continue to put money in the, well, let's not go into that. But nevertheless, we need some people to look into this, do some researching, and for God's sake, join our new program called the Inner City Network, ICANN, and the email for ICANN is ICANPA2021@gmail.com. We need all the help we can, because I don't like the idea of being involuntary euthanized. And that's what happens when you see without a doubt that a person needs help, that a person is unable to care for themselves because of age and illness. But if you shorten their hours, they don't have to be agreeing to dying young. They're going to anyway. They don't have to be agreeable that I can't get water or fix my meals because I'm bedfast. They're going to die anyway. So when you look at these things, look at them like in the reality that they now exist. We need help. We need your attention. And above all, we need your prayers, as well as foot soldiers that are out there saying, I remember this, or I know a person who was going through that. And instead of them merely just giving the prayers, we also need the boldness of the spiritual, of the Spirit of God to do something about what's wrong. When you see it's wrong, you don't sit and allow it to overwhelm you. You don't sit and allow it to take one of your beloved ones away.
Okay, and Annette, slow down just a little bit. You're doing a great job in presenting the case. Now, let me see, I clearly understand. You threw out what is it, an email address, and then you said, is this an organization that is fighting this conditions? Can you
yes.
give that again, please?
Okay, the email address is ICANN, that's the name of it, it's Inner City Network. I, like ice, C is in Charlie, H is in Alpha, N is in Nancy, P is in Paul, A is in Alpha, 2021@gmail.com.
Beautiful. Now, let me ask you again, and excuse my ignorance, but what agency supervises this program for the elderly? And is it a state agency or is it a federal agency? And what's the name of it?
It's a state agency, and all of this came about after the federal government released all of this power to the state.
I see. So the state
all
is
of this
basically
came about
responsible for
after
this.
the fact.
And
Yes.
what is the name of the state agency that's doing this? You know?
UPMC, University of Pittsburgh Medical Center.
Okay, all right. The medical center itself, that's not a state agency. Okay.
Oh, wait a minute. The state Department of Health and Welfare. Yes, I'm so sorry. I'm getting ahead of myself. In fact, I'm looking for the letter to read where they actually, my doctor, he sent this information because he's quite concerned that I may not be around much longer, simply because I do not have the kind of care. Okay. I do not have the caregiver's hours have been short.
We're slowing down in terms of time. Do you have the letter there? Because I've heard the letter, and I think it would be beneficial for the people to hear that letter. Do you have it in front of you? Can you?
Okay.
Read?
I'll read it.
Okay.
Let's see if I can bring it back up.
Slow down a little bit. Take your time and read it, and then we'll close out with that.
Says,
but I think that letter is very, very important.
It's dated April the 13th, 2021, to the UPMC, Unit of Positive Internal Medicine, 305 Sir Thomas Court in Harrisburg, and it was sent to Commonwealth of Pennsylvania, Department of Human Services, Bureau of Hearings and Appeal, 23320 Barton Way, Harrisburg, Pennsylvania. Due to her worsening medical condition, we are requesting an expedited hearing for Ms. Branch. Please be advised, Ms. Branch has the following medical condition that requires around-the-clock care: chronic obstructive pulmonary disease, moderate persistent asthma with exacerbation, chronic diastolic heart failure, lipodemia, degenerative arthritis of both knees, hypertension, bilateral leg swelling, coronary artery disease, chronic kidney disease, and obstructive sleep apnea. Her condition has been declining since January 2021, in that her chronic obstructive pulmonary disease can exacerbate very quickly, which requires immediate action with her nebulizer and medication. She lives alone and has no family in the area. If someone is not with her 24/7, she could go into cardiac arrest, stop breathing, or fall, all of which could be prevented with continued provision of care by in-home providers. She has had around-the-clock care provided through the waiver program, which was medically necessary and justified. Removing or reducing care puts this patient at risk of injury or death. I am requesting immediate restoration of 24/7 care for Ms. Branch. This is of immediate urgency, and I request immediate restoration of 24/7 care pending the outcome of any hearing or determination of her benefits. This is a matter of life or death for this patient. Sincerely, Jack Holland Moody, medical doctor. Now, I guess I'm not dead yet, or I can get out of bed with help, But long as you're breathing and you can get around on your cane and walker, that's fine. But
Okay.
this involuntary euthanasia, I see it clearly.
We're at the end. We got to go to our next guest. I think you've made presented a great case. I know you. Whenever you present an issue, it's real and it has to be dealt with. And we're gonna have to bring you back so we can finish this and get it done, because it sounds like it's really critical, and see if we can get going. But we got to move on to our next guest right now. I want to thank you very much for coming on the show.
Thank you. I'm honored.
We've had a few little technical difficulties, but you got it done. I think you presented your case. And we will continue to support you, and we wish you the very, very best, because it's a critical issue and you're having a situation yourself, but you're representing thousands of other people who have the same problem, who have the same issue because of the cutback in funding. So we're going to say so long, and thank you so much for coming on the show. And what I want to do, like I said, is to bring you on again.
Thank you so much. I look forward to it.
Take care. We're going to move ahead now to the next phase of our show. We're looking at a situation where we have the worst virus that's been presented and to our people, not to the world, for God's sake. This virus is all over the world. This COVID-19 virus is really killing us. And I'm very happy to have with us Mary James, like I said, my wife, who is the chairman of the local Lynx chapter, and they have a special project. And I'm going to turn it over to her, because she has members of her organization that are responsible for handling this project, and she's going to introduce you to them and tell you something about it.
Okay, thank you, Richard. And thank you for having us on and being able to get the message out. This project that we're going to be discussing is being hosted by the Harrisburg PA Chapter of the Lynx Incorporated. And I have the brainchildren with me this afternoon who birthed this initiative that we're very, very proud of. The first I'd like to introduce is Marcia Perry-Dix, who is a member of the chapter's executive board. And she is also chairperson of the Health and Human Services facet of the organization.
Welcome, Marcia.
And
welcome.
Thank you.
Let us hear from you. Okay.
Very excited. I'm here.
Okay,
Thank you.
good.
We have a lot to say.
Okay. And our second representative here, also a member of the chapter's executive board and chairperson of the National Trends and Services facet of our organization. So together they have worked very, very hard on this initiative, which is most needed in the African American and Brown communities of our area. So I'm just going to turn it over to them and let them speak to what they are, what they have planned.
And I will have some questions for you, okay? But
Absolutely.
Let's let us hear from both of you, and you can present your issues and your program and this important
right.
meeting you have coming up.
Yeah, well, I'm going to kick us off a bit. Hi, I'm Cynthia Lester-Moody. I'm so glad to be with you here today. I'm going to tell you a little bit about our organization, the Lynx, and the Harrisburg chapter of the Lynx Incorporated. The Lynx Incorporated is an international non-for-profit corporation established in 1946. The membership consists of over 16,000 women worldwide, and that includes 41 states, the District DC, and the Commonwealth of Bahamas in the United Kingdom. It is one of the nation's oldest and largest service organization of extraordinary women who are committed to enriching, and this is very important, sustaining and ensuring the culture and economic survival of African Americans and other people of African ancestry. Our core values are friendship, integrity, honesty, service, commitment, family relationships, courage, respect for self and others, legacy, confidentiality, responsibility, and accountability. Our programming is key to what we do. We serve, and all the women are committed to doing that in the organization. And us here in the Harrisburg chapter, throughout all the chapters, they focus on services to youth, the arts, national trends, international trends, and health and human services. You heard Mary talk about the areas that we're representing in the chapter. Specifically, national trends and human health and services is really, and what's going on in our communities today, have to do with COVID. And what's key right now is the vaccination. And the intent of us talking about this today, as well as telling you what we're going to actually do, is to bring awareness, tell people how they can get the vaccination, dispel some rumors, give facts, and in the Harrisburg area. I can turn it over to you, Marcia.
Sure. Well, just to add what Cynthia mentioned, our chapter of the Lynx Incorporated, we are severely honed in on our service and our commitment to our community, especially here in Central Pennsylvania. We know that the COVID pandemic hit Black Americans the hardest. It hit our cultures and our communities the hardest. And our organization, the Lynx Incorporated, from a national level, really supports the administration of the COVID-19 vaccine. So in following suit with our national organization, the love and the thought and the research and the data that they really took to heart, we really wanted to showcase what we could do here in our very own city. And that is why we declared this pandemic a state of emergency. And our goal is to break the barriers in health, on health in the Black community. What we know is that there are challenges in communication, there's inequity, and it affects our communities in disproportionately high rates. Those are facts that we cannot dispute. However, our organization, we are steadfast in helping our brothers and sisters in our community get healthier by dispelling some of the myths about the COVID-19 vaccine, the vaccination, the virus itself. And we have a lot of very smart women in our chapter, including Mary James, that's on this call today, and who's our fearless leader. And we are fighting this with everything we've got. So as a state of emergency, breaking barriers on health in the Black community, we are so proud to present that our chapter will be hosting several events in collaboration with our community partners, Penn State Health and Highmark. And I thought I would throw it back to you, Cynthia, to give an overview of our community partners and the work that they're doing to get into the Black community and to educate and vaccinate us.
Right.
Let me ask you a question.
Sure.
First of all, you mentioned this whole hesitancy thing in the African American community. We can't blame that on white folks. We have some horrible, horrible conspiracy theories that are out there in regard to this vaccine. And I understand you have a date that's coming up right away tomorrow, right at the Allison Hill Community Center, which thrills me because I worked there for a number of years. Can you just tell us that there it is? That's the announcement. It's excellent. That experiment. Yeah, May 12th. So I'm gonna let you go ahead, Cynthia.
So to talk about the hesitancy, you're right. There are conspiracy theories. I can tell you personally, my mother-in-law grew up in Tuskegee, Alabama. And so she is so some of it is conspiracy, some of it is facts, and some of it is awareness and understanding. And our goal here is to give folks facts and to help them understand that why it's important as a whole, our community gets vaccinated. You just showed the flyer that we created. And can you bring that up again, please?
Sure.
Yeah. And what we wanted to do is what's key we found through our conversations with people in our organization, as well as our partners, Penn State Health and Highmark. And I work for Highmark, actually. I work for United Concordia, which is a Highmark Health company. Right. And there was an opportunity for us to align to help our community. It is key that we focus on communities of color because of underlying factors that have impacted our community, as well as misinformation, conspiracy theories, as you said. So we are offering it in the place that is easy for them to get to in the community. Here in Harrisburg, we're going to be having the clinic tomorrow from 1:30 to 5:30. It's got the Allison Hill Community Center. That we will stay tuned. We will be having more dates in Harrisburg, but we are taking walk-ins as well as people that can sign up. Walk-ins are encouraged. In fact, I found for other experiences at other clinics I've served at, I did one in Lancaster. Guess what? The majority of the people that came were people that did not wake up thinking they were going to get a vaccination. But once they heard about it, they talked to family members. They looked at information on Fast Facts about the vaccination, and the fact that we are doing the Moderna vaccination, it gave them a little bit more comfort. They came down to ask questions, and guess what? They got the vaccination.
Fantastic.
So we're excited to offer this in our community, and we're glad to be on the show to promote this.
Yeah.
I'm happy you're doing the walk-ins because I think that's been a major problem. I know my wife and I tried for weeks trying to get vaccination. We were not able to get an appointment. So if you're down in the African American community, I think you get a whole lot more people if they can come in with their ID and get the vaccination right away. I think it's absolutely wonderful.
Thank you.
And I think that's been part of the challenge in our community. Yeah, we talk about myths and some of the things that we make up based on truth and based on historical facts. But truthfully, I was just as confused as you in the beginning when the vaccinations became available. I did not know how to do it. Should I go through my insurance provider? Should I just call the hospital? Should I show up at one of these sites? I did not know what to do. So I started registering for everything and seeing what would happen. And I didn't know what to do. So if you can imagine someone, I'm on the internet 5 million times a day, and I consider myself pretty tech savvy, but I feel we were getting mixed messages from media and the news outlets. And the information that we really truly needed was just missing us, our community. And we weren't able to connect the dots like other communities were as quickly. So that is why I feel so encouraged where we have community partners and our chapter and our chapter sisters, and we are linking ourselves truly to our community and really getting the word out there just so that people know that it's free. You don't need an ID, you don't need any money, you don't need an insurance card. You just need to get your body there, get your card, and then follow up with your second shot.
One thing, you have to bring an ID because of age. Sorry, that's the one thing. It's not needed for what people may think it's needed, not to track you. It's to prove how old you are, because the vaccination can only be administered to people over 18. So that's a key thing. So it's not, oh my gosh, they're going to track me, they're going to do this.
Right.
It really is about validation to make sure you meet the requirements to get the vaccination.
You do know that the vaccine was approved for 15 to 19-year-olds. It was just approved, I think it was the other day. So that in the future, that would be available. My question is, how do they schedule their second dose?
So what happens is once they get their vaccination, people have to wait 15 minutes just to make sure everything's okay, make sure, you're feeling okay. At that point, we use that time to schedule the next appointment. And then after that, the Harrisburg chapter of the Lynx Incorporated members will reach out to remind people that have gotten the vaccination when their next vaccination is, and it will be at the same location. Those dates will be given to them when they arrive. And with a card, they'll get a card.
Good.
That's great. That's great. Well, the other thing I'm gonna ask you is who is administrating the dose, the shot? You have volunteers, you have staff people who will be doing the actual sticking.
I can answer that, Marcia, if you want me to. Clinicians from Penn State Health in our community from Hershey will be administering the vaccinations.
Excellent. Excellent.
I was gonna add you to our volunteer list, Mr. Richard. Can you give a shot?
No, I can't. But I'll do the best, and I hope you can get somebody who can.
Right. Well, we'll have lots. We actually saw the list. They've implored a lot of clinicians to make sure we're ready, and they have people on call. If we get a mass rush of people in, they're ready to call in additional clinicians. However, what we would love, Mr. Richard, is if you come and help prevent the runners. I'll tell you, I was a runner, and what that means is you get your shot and you're in a rush. So you want your shot and you want to get out and not sit down and wait and everything else. Well, I was one of those people. I had to go to another meeting, so I was ready to get out of there and get out of Dodge. Well, I didn't. I had to sit down. I was called the runner. They got me back, sat me down to make sure everything was okay. And it was, but it gave them time to give me facts about what I could experience and also to sign me up for my next dosage.
Yeah. Well, I'm not able to do that physically, okay? But what I can do is put you on a radio television show so you can promote your event. That's what you can from Mr. James.
And we thank you for that.
I'm medically unable to do that physical kind of thing. Otherwise, I'd be there because I used to work at the Allison Hill Community Center and was director of the AIDS education program for 2 years.
Oh.
I'm familiar with administration. I'm saying you have a good thing. And if anything I can promote, I will do that. Okay?
Absolutely.
Yeah.
We're really excited, and we really want people in the community to come. And even if you're not sure, please come by and ask the questions so we can answer your questions and give you the facts. And I was fearful. I was very fearful. I got over it because you know what? I want to have a summer. I want to enjoy. I want to be safe. I want the people around me to be safe. So any questions, you get up in the morning and you decide you want to do it, please come down to the Allison Hill Community Center and ask your questions. And we hope that convinces you to get a vaccination. If not, we will be sharing at that time additional dates that we'll have in Harrisburg for you to get a vaccination if it isn't good for you on that day.
Excellent. Excellent.
Thank you.
So you will at that time, let people know exactly when they can get the additional doses. Now there was a center for vaccines in Lancaster. You said you were involved in Lancaster?
Yes, we did it. We did it in collaboration with the NAACP of Lancaster.
And how did that work out?
It went well. Like we said, we we went there. We started off with one person that registered, but we had over 20 people come that woke up that day and did not want a vaccination. However, by driving by a family friend or a family member, convinced them to come down. And I'll be honest, the other thing, mothers, and typically mothers kind of lead the healthcare discussion in families, especially in our families. They got their spouse to come. So, and I love to see that, to see couples coming together to get their vaccination.
Well, I don't think you could have gotten a better location than Allison Hill Community Center on Walnut Street. It's right dead in the middle of the community, and people are constantly moving to and forth. And it's a very popular community center. A lot of community activities take place there. And they've been there for quite a few years. I worked with a woman named Charlotte Tatum, who was the former director of that program, also, and Marcia Reed, who was involved in that program also. So I'm sure you do quite well.
Thank you.
The walk-in is really critical and important because you can encourage people to come in. But those conspiracy theories, I've heard some crazy ones.
Me too.
Someone told me that Hank Aaron got one vaccine and just fell dead.
No, no.
Oh my.
I mean, their lies, their theories, they've even, what about the politicalization of that? That's the other thing, that they're trying to make it political. Some people are saying that there's a lot of Republicans saying that who support Trump, they're saying they're not going to get it. But the interesting thing about it is that Trump's got the vaccine.
Yeah.
So, but you know.
And that's in what we've learned and what I've been talking to people when I was down in Lancaster, because that's the only one that I've been a volunteer at to date until tomorrow. People just want to understand. They just want the facts. I think they don't want, the reason they're coming up with these theories is to protect themselves in their minds. But when I started talking to folks, they realized that I'd rather have the vaccination and get my family safe because it helps our community. It helps my family. And people want to see their grandkids. People want to see their family. They want to go to a family reunion.
Right.
And this is helping them get there. And I think the fear of staying the same is not as great as the want to get the vaccination so they can spend time with their families.
Mm-hmm. Well, you know, just to add, I'm so glad that there was the foresight to locate this pop-up clinic in the heart of the community. And what I'm hopeful of is that we will capture a lot of those individuals that don't have computers that they could use to register for a vaccine and don't have access to immediate information. So I think by virtue of us being there and catching people as they walk by, we're going to stimulate curiosity and hopefully get a significant number of walk-ins that normally they would not be able to reach us and we would not be able to reach them.
You're right. You're exactly right, Mary. I think we take for granted that everyone has a computer, everyone has internet, connectivity, and that's a bad assumption. And the other thing is that people also transportation to get to some of these vaccination sites. Folks don't have that. And when we have it in the community, it increases the probability that people will walk by and see it and come in, ask the questions, and then hopefully get a vaccination.
Right. Hopeful.
Yeah.
Thank you so much for your time today. We'll have volunteers on site tomorrow to hold hands if you're scared. I'm actually scared of needles. I have a real fear, and they're just lovely. They'll sit with you and hold your hand and make sure you get through it, and you don't even feel it. So, I hope we get to see everyone out tomorrow in the community. It'll be really fun to see everyone.
And I encourage, and I'll end that off with saying, even if you wake up not thinking you want it, come by and say hi. Yeah. You never know, based on what you hear, you may change your mind.
And again,
thank you.
Wednesday, May 12th, from 1:30 to 5:30 at the Allison Hill Community Center at 1524 Walnut Street. in the heart of Allison Hill. And we'll be doing the first dose vaccination, Moderna, and vaccinations are free. And we'll follow up with you on your June date for your second dose.
I want to say that I am proud of the Lynx organization and the kind of services that you render to the broader community. This is a wonderful and a very necessary and a very timely project that you put together. And I don't think you could have gotten a better location. And by the way, that community, though predominantly African American, is very diverse. You have a large Vietnamese element there. You have a number of Africans that live in that particular community. So you have, and it's not far from Hamilton Health Center. So you have a number of individuals that are in the community that will be walking by, you know, and then just coming into that center because they have a tremendous after school program. They have kids that they come in, and the kids have parents and that kind of thing. But I wanted to welcome you to the Richard James Show. These are the kinds of issues that we deal with and we present and we allow and we promote things that are critically important to the community. So again, I want to thank you and wish you the very, very, very best, and let us know when we can be supportive of anything that you're trying to do.
Absolutely. Thank you very much.
Thank you, ladies.
Thank you.
Take care now.
Take care.
Bye.
So long. Oh, all right. That was good. You have to stay if you don't want to.
Okay.
I want to thank these ladies for coming on and presenting this issue. This issue is a very, very critical issue. But I want to just kind of talk a little bit about this whole hesitancy thing. You know, we have a tendency to want to blame the man for everything. Anything that happens in the African-American community, we want to say white folks did it, or because of racism or discrimination. And that's largely true. We have a lot of racism that exists within the community, but it's a lot of things that we do to ourselves, or we can correct ourselves. And here we have an organization of African-American women. And I'm proud of my wife, who was the chairman of this particular chapter of the organization, that's setting up and encouraging our folks to get out there and save themselves. I mean, it's not like something that is just for a small, narrow group of people to save themselves. The thing about that vaccine is that you're not only protecting yourself, you're protecting other people. So it's a win-win situation, no matter how you look at it. And I'm going to say to my friends, I didn't say this on the show, but I was blessed to be the first director of the Allison Hill Community Center, which one was located on Market Street back in the 60s. And we had a number of programs that are going on there. So I know the kind of things that are, and that's a wonderful community. You have a lot of beautiful people that live in the Allison Hill community, and some of them have been there for many, 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 many years. I mean, years ago, my good friend T.Y. Toby Young over on Regina Street used to have a wonderful record store. But one thing I say about Allison Hill, that they do positive things. Now, when I was at the Allison Hill Community Center, the one located on Walnut Street, I lifted up the AIDS education program. And in which time we had a real epidemic of AIDS. And at that time, we didn't have any cure for AIDS. Now we have a cocktail that can manage AIDS just like people manage diabetes. Now, we don't know where we're going with this virus. We don't know what the future holds for this virus. We don't know that we're going to need a booster shot. We may, at some point, have to get a shot every year. We don't know that. We're still being educated about it. But one thing we do know is that we can't do like the national Republicans are doing and trying to live a lie. You know, we can't live by untrue theories and conspiracy. Now they're trying to wonder who created the virus. Was it in a laboratory in China? What in the devil does it matter? We have got to learn how to deal with it and how to handle it, and to stop blaming other people. They're trying to make it a political issue when it's a health related issue. So I am glad that people are getting involved and they're beginning to challenge these crazy, wild theories that have been put out about the virus. And when our finest get involved, it's very, 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 very important. I'm hoping that we can also get our newly formed vice president, who's a very busy lady, and who has said so many things about this virus. I'd like to get her on my broadcast or to get her locally to have her lift up. Now, she in her own right have been trying to encourage our folks, but we know we can be a hard sell. We can be a difficult sell. And so we need all the voices that we can in the world to be able to get it done. And I think we got people like, I know we have people like Robert P. Casey Jr., who is our senator, who has also promoted and supported the Biden agenda. And Biden, I have to say, over his first 100 days, the man is getting it done. And he is taking this virus very, very seriously. And what he's doing is he's making money available when the resources would not be available before. We had an ignorant president who said, suggesting that people put Lysol or something into their wounds. But now we have a realistic approach in which we are encouraging people to use scientific evidence. The thing we need to do is just listen to science and go ahead and get it done. But throw away those crazy conspiracy theories. And I'm finding out that even some healthcare providers have some hesitancy. Remember, in the development of this virus, this vaccine to deal with this virus, science was used. They had to speed it up. When you had cases developing all over the world, in Australia, United Kingdom, Europe, and now they've grown in Africa, and they're all over Africa. We had that, scientists had no other way of dealing with it, but try on an emergency basis and trying to do it as fast as they possibly can. So thank God for the fact that they were able to put together a vaccine to help save the world. Now they tell me that over 3 million people, listen to those figures, over 3 million people have gotten the virus throughout the world. I'm not sure exactly how many deaths it is. I think it's 3 million deaths. It's terrible. So what we're trying to do is trying to get that vaccine out to everybody so we can cut that down, and hopefully we will have a good Christmas. I don't know, that maybe that's too much to ask for, but I'm hoping now. Biden is saying that he was hoping things will get back to normal by July 4th. Now we are very, very close to July 4th. I don't know how possible that is. I hope it's true. No one wants to wear a mask. I don't like wearing a mask, but I would rather wear a mask and be well than to not wear a mask and be sick. So the masses, I think it's a little sacrifice that one has to make to do it. But we have a lot of folks, they go through what I call this macho thing, macho man, that, they're so great, and that they have these immune systems that will fight off any virus. And that's not necessarily true. I expect that people particularly who handle food and who deal with the public, should do everything they can to make sure their customers are safe and pure. And again, I'm going to thank and I'm thankful to the fact that at least we have a president that have put up resources. And I understand now pharmacies, some of them are handling shots and arranging for shots. Some of them still require an appointment. I still have a problem with the appointment thing, because not everybody is computer literate. I don't happen to be a computer literate person. I can, shall we say, move around in a community to some degree. But some people, first of all, they don't have the money, they don't own a computer. So let them come in with some kind of information or ID and get the advice. The other thing that we need to do is to make sure some of our general practitioners, our internists, for example, our doctors, that they're capable of giving the shot. And I understand that some of that is going to be true, that they will be getting the vaccine and administered it. That would deal with the situation in terms of hesitancy. People will have a tendency to agree with and appreciate the advice that they get from their doctor more so than what they see on TV and what they see from other quarters. The other thing that I think that we need to do is to try to get our churches more involved. Some churches are already involved, but these ministers, people tend to believe more about what their minister says from the pulpit than they do people on the street. So whatever it takes, whatever energies that they project, then we need to do it to make sure these people get vaccinated. Other thing that we need to talk about is our rural areas, what some people call Trump country. Out in the countries, in the wilderness, these people believe whatever lies that are being told by people in authority, particularly conservative in authority. And we need to get out into the rural areas as well as the urban areas and make sure we are able to go to the churches, go to the community centers where people gather, go to the farmers market, for example, and try to get those people out in the country vaccinated. So as soon as we can they say we need to get up to about 70% for herd immunity. And herd immunity means that you really don't have to worry about wearing a mask and that kind of thing, because that will be taken care of. Now, we live kind of in a suburb rural area. We live out here in what we call Fishing Creek Valley, and some of it is called Trump country. I think I see more Trump signs than I see anything else. But right in my community is divided. But we want these people to be safe also. We want everybody to be safe. All lives matter. You got a group organization you call Black Lives Matter, but I'm saying that all lives matter. And we have a worldwide epidemic where we've got to look out for everybody. We need to understand that we're no longer just one place, that we are a global community. And what happens in Australia may affect folks in South Africa. What happened in South Africa will affect people in North America. What happens in Europe affect people in Africa. So we're in a worldwide community. And in this worldwide community, we need to support each other. One thing we've been hearing lately is that there's some serious problems in the country of India. Now, people should understand that India is the second largest country in the world. There's over 1 billion and a third people in the country of India. India is highly diverse. There's over 100 million people of African descent in India. There are Asians in India from Southeast Asia. And India is having a hard time right now. India is known to have a wonderful healthcare center, and they, I understand, produce more vaccines in terms of manufacturing vaccines than any place else in the world. I don't quite understand why they can't keep some, but now vaccines are being sent to India from the United States of America, and I understand from the UK, I understand from the European community in order to help folks in India. But we're hoping, we're praying for these people. We're doing the best we can to be supportive. And I think politically we can let folks know that we're all in this together. We're not just a single group interested in one person or one group or one area. We are interested in everybody. It doesn't matter where you are or where you live. We live in central Pennsylvania. I love central Pennsylvania. Came back here from the city of Seattle, and we have some wonderful people in such a beautiful, beautiful, beautiful land. We want to keep it beautiful. We want to keep people well. We want to make sure that they get this virus and they get this vaccine and they're able to take care of this virus and have this virus move on. Personally, I want to thank you for tuning in to the Richard James Show today. It was a vital show. I think Ms. Annette Branch had a lot to give. We had a few technical difficulties, but she did give a presentation which is critically important, because they're cutting back on the delivery of health services to people in need, particularly the elderly people, people who are disabled or handicapped, and they don't need to cut back. So we need to make sure that people like Senator Casey is aware of what's happening in health and welfare, and the fact that they're cutting back on these resources, and some people who need round-the-clock assistance are getting it. And we should make sure that our nursing homes, where people, first of all, most of our people, our deaths took place in the nursing home. And that has to do, I'm sure, with the administration of the nursing home, but we got to make sure that they have the resources to be able to deal with that virus. I'm Richard James. My business is African Paradise. You might see this giraffe that's behind me. These are some of the items that we sell. And we like to keep this on the air. We have the support of Christopher Thomas and his family. And for their support, we're able to put these kind of things on the air and to let people know we're doing a good job. They're doing a good job. And there are other shows that come on and deal with issues and deal with concern. So thank you so much for tuning in. We're sorry about the few technical difficulties that we have. We do the best we can, and maybe the next time we'll do better, but at least I hope you got the point. Healthcare delivery system for elderly needs to be improved. Resources need to be improved. People need to get the vaccine. There's an event tomorrow on May 12th from 1:30 to 3:30 at the Allison Hill Community Center, sponsored by the Lynx Harrisburg Chapter, Lynx Incorporated, and Penn State Health. If you haven't been vaccinated, go by and get it. God bless you. Much love to you and to your family and to your friends. In the words of the late, great Toby Young, your neighbor and your friend, God bless you all. Take care now.
Thank you again for tuning in to the Richard James Show. Our African and our African American programs are set up to educate you on what's going on in this world. And thank you for taking out the time. So listen, let us hear from you sometime also. So this is your neighbor and your friend signing off. Until I see you again next week and hear from you again next week. So long. God bless.